Good morning, everybody. This is Dr. Sonia McGowan with Covenant Pediatric Wellness Center, and I am with you today for our monthly webinar. And today we're talking about our approach to recovering complex kids at our practice. So I'm going to be talking to you about precision nutrition. Some people call it biomed. Some people call it functional nutrition. So I just, it's a simple thing and it's a complex thing. And so I'm just going to kind of walk you through how we do it here. So first, in case anybody doesn't know me at this point, I live in Jeff City with my husband, Shannon. He is a CPA. We have two kids. We have Libby, who you see there. She is a musician. She's a grown girl now. She's 21. She lives in Kansas City, and she is the music director for School of Rock. We also have Rowan, who also is gone. We have a sort of newly empty nest. He goes to school in Illinois. He is a theater costume design major. Crazy talented. Love it. It's great. We also have our baby Ozzy, because we couldn't just have an empty nest. We had to adopt a puppy. So he's our sheepadoodle. He's about 14 months old now. And really, Covenant is what it is because of what we went through with Rowan. So he never had a formal diagnosis of, autism, for example, but he did struggle with dyslexia and auditory processing disorder. He was nonverbal till he was about 4, had some overwhelming behaviors. He didn't sleep. He was covered in eczema, right? And so I consider him my first recovery story. And so all the things we went through with him really sort of shaped the way we do things at Covenant. I don't want parents to feel alone. I don't want them to have to work so hard to get services for their kids. I want them to be respected and listened to. And so that's a lot of why Covenant is the way it is today. And so we do a lot of things here at Covenant. So we work primarily with kids, with complex kids, but we also have a pediatrician on staff, and we feel strongly that we respect parents' deeply held beliefs around certain things that other doctors require, if you know what I mean. We also do a lot of work around oral restrictions, so tongue ties, lip ties. And then we also have an early beginnings program where we work with prenatal patients via chiropractic. We have 4 doctors on staff who are Webster certified, all very experienced and qualified to work with expectant mothers, also with newborn babies and older kids as well. And we also, work with adults as well. So what I want to cover for today is what I mean when I say complex kids. I want to talk about what precision or functional nutrition is, how you might know if you're a parent, if your child would benefit from what we do, and, just really what that looks like and what the changes look like. So when I say complex kids, I mean lots of things. So when I started in the field, I started working just with people with autism. So that was purely my focus for years and years. And as things have evolved and changed, what I noticed very clearly is it's not just autism anymore. So we have kids who have PANS and PANDAS. I consider that a complex kid. Sensory processing problems, ADD, ADHD, kids who have retained primitive reflexes, kids who have oral restrictions, and, behavior, language, socialization issues. So whatever might be getting in their way in terms of behavior, language, or socialization, that makes them a complex kid. They need some extra support. And I call them square peg round hole kids. So these are kids who don't necessarily have a diagnosis, but they're struggling. So maybe they're not sleeping. Maybe they're constipated. Maybe they have very selective eating. So in general, they're just struggling. Focus, attention, making friends, whatever it is. These are the kids who we really take a special interest in. And so here at our clinic, we believe that there are no bad kids and there are no purposeless behaviors. So we always look at and for the why behind behaviors. So I remember when Rowan had just horrible diarrhea. for example, he would have, 20 diarrhea diapers a day. And I would talk to his doctor and it was just, oh, he's fine. It's not a big deal. Well, guess what? It was a big deal. That wasn't normal. It was common, and it is common for lots of kids who we work with, but it's definitely not normal. And so we have to look for why those kinds of things are happening. And so how do we know if we have a complex kid on our hands? Well, we listen to the history, we look for physical signs, we look for behavioral signs. And so when parents tell me certain things, my ears perk up, right? So I ask about and I listen for things that would have happened in infancy. So did they have birth trauma? Did they have any issues around their milestones? So delayed milestones we all know about, right? But being advanced on your milestones isn't great either, right? So it generally, when kids do things faster than they should, it's often a red flag for me because it's telling me they probably have high tension in their system. Things are not going along the prescribed path. That's a red flag. I remember when Rowan was a baby, I wrote in his baby book, Rowan just rolled over at 3 days old. No one will ever believe this. I thought it was a mark of a genius, right? Because I didn't know what I didn't know then. What that tells me now is he was very tense. He it wasn't that he was advanced. It was that he needed extra support, and I just didn't know that. So if a baby has trouble nursing or sleeping, if they have head shape differences, if they have restricted oral tissues, if they have early antibiotic exposure, that is a big one. So it's super common for kids to have lots of ear infections. Common, not normal, but very frequently the kids who we work with later down the road have a very significant history of taking lots of antibiotics as a baby. And so I also ask about toddlerhood. So what was their temperament like? What was their energy level like? Did they have any issues around, reaching their milestones, ear infections? How did they respond if they got vaccines? Did they have a regression? So it's very common for parents to tell me that baby was fine or child was fine until something happened, and then they lost skills. Sometimes they regain those skills, sometimes they don't. But regression is a big red flag. And I ask about if a child's behavior improves with fever or illness. That's important. I ask about urinary changes. I ask about anything with an overnight onset. So, kids don't become mentally ill or autistic overnight, right? So when something is an acute onset like that, I definitely want to dig in a little deeper. I have a big 3 in my head. So when I'm taking history on a family, I ask about sleep, eat, and poop. So how do they sleep? How and what do they eat? And how are their poops? Generally, we find a hit somewhere in here that most kids struggle with sleep, they struggle with eating, they struggle with pooping. And so the physical signs I'm looking for, I start with looking at the skin. The skin is always a reflection of the gut. So I'm looking for things like eczema. I'm looking for things like hives and rashes. I'm looking for what we call KP, keratosis pilaris, also known as chicken skin. So just those kind of bumps, particularly on the upper arms, is the most common. I have seen kids who've had this kind of skin from their eyebrows to their toes. I look for dry skin. I look for stinky feet, an odd body odor. I look for dark circles under the eyes, especially when the child is very pale, then with dark circles. And I look for, so I mentioned skin, of course, the eczema, but I also specifically look for what we call a herpetiform rash. So this is usually on the backs of the knees, sometimes on the anterior elbows, so the bends of the arms. This almost always means a gluten sensitivity. I remember Rowan had this, and it was severe, and sometimes it would even crack and bleed. And as soon as we took him off of gluten and dairy, it all went away. So I look at hair. So is their hair growing the way it should? Are their fingernails and toenails growing the way they should? Is their hair thin and sparse? Does it fall out? Does it break? Does it fly away? All of these are telling me that there's something metabolic happening that needs to be corrected. The lips and mouth give us a lot of signs too. So kids who have very dry lips, kids who have cracks at the corners of the mouth, all of this is really pointing me toward deficiencies. Sometimes we'll see a geographic tongue. We'll see a tongue with a fissure down the middle, and on the fingernails as well. So sometimes we see spooned nails. It's really common for me to see the white spots on the nails and then ridges as well. So again, all of this is pointing towards some sort of metabolic issue. I pay close attention to their head. So do they have a super prominent forehead? That generally means a vitamin D deficiency. Is their head large in relation to their body? And how is their head shaped? Do they have a flat spot on their head? Do they have, any sort of postural distortion? That those kinds of things generally go together. So, as I'm doing this, I'm gathering all this information about what the child's body is telling me and what the parents are telling me as far as their history. And then generally we see issues around their tummies. So a very bloated abdomen is super common. Also really common to have a bloated belly and then kind of wasted bottom. And also generally abnormal bowel sounds as well. And so some of the behavioral things that I'm looking for. These are kids who have a lot of issues around food generally. So they're very selective eaters. They like to graze. So they just sort of eat all day instead of sitting down and eating specific meals. Often they have a self-induced limited diet. So I consistently have moms and dads say, hey, he eats 5 things. That's it. Every meal is exactly the same. And a lot of times kids will have cravings. And I pay special attention to the cravings because what a child craves is generally what they're most allergic or sensitive to. So when a parent says, oh, he gets most of his calories from cow's milk, it's a red flag, right? Because he craves the milk. It fills him up, but it's probably, for a lot of kids, it's an endogenous opioid reaction. So milk and wheat sort of do the same thing to the brain that an opioid drug would. And so kids very much crave that. Lots of digestive challenges. So kids who, for example, will posture. So we call this posturing. These are 2 different kids. They do not know each other. They live in far-flung away from each other parts of the United States. And you can see they both have the same posture. Both have pretty significant digestive issues. So this is a really strong sign that a child is having some belly pain. We also see lots of gas and bloating. We see reflux. We see a lot of drooling in kids, especially who should have good saliva management at their age. Drooling is a really strong sign of acid reflux. Very common for parents to tell me, they see undigested food in their child's poo, lots of belly aches, lots of constipation, diarrhea. Sometimes we see both. So kids will alternate between constipation and diarrhea. A lot of kids will withhold poo. This little girl, that's what you're seeing here. She keeps sort of this posture with her legs crossed because she's working very hard to not poop. Lots of sleep challenges. So kids will become hyper or fearful at bedtime, trouble falling asleep, trouble staying asleep. Often they will wake up and laugh or talk to themselves in the middle of the night. They will sleep with their mouths open. They will snore. So all of these are really strong signs that your child needs intervention if you see this. We also see issues around energy. So a lot of times we'll have kids who have really low stamina. They take a long time to recover after physical tasks. They want to be carried. They want to ride in a stroller. They may say, that their legs hurt. Please carry me. And this little guy who you see in this picture, this is Liz, our occupational therapist, working with this little guy. And what we discovered about him is that he always ate laying down. And so this is a really strong sign to me that he's not really great at making energy inside the cell. And through some testing, we figured out that was true. He just did not have the ability to do 2 strenuous things at a time, sit up and eat. All right. So when you think about these kids, what I have seen over my long career is that these are the kids who are generally forgotten or ignored by traditional or regular medicine. Parents are very frequently told that an obvious medical issue is just autism, or it's just whatever, fill in the blank. It's just pandas. It's just ADHD, right? And so these are kids who are often denied just basic medical care because of their complex diagnosis. So parents will say, "Hey, pediatrician, I can you run a blood test for vitamin D and anemia?" Right? And most parents are told no, and which is frustrating to me because I'm not sure I've ever seen a kid in my practice who didn't have some sort of finding when we did labs for them. And so when we talk about our approach here, I use the term precision nutrition. It's also called functional nutrition. And basically, this is assessing and addressing the specific nutrients and the biochemical processes that a child needs. So we test, we don't guess. So while history and behavior and physical exam give us lots of clues, we want to be super specific. And so that's why we rely on blood tests, urine tests, stool tests, for example. We have lots of test options. So it's based, I don't do the same thing with every kid. I base the testing on your child's specific presentation. And then the intervention plan is based on those test results. So everything about your child is targeted to them and their specific needs. So there are lots of commonalities that I have discovered over all my years of doing this. Number one is nutrient deficiencies. So even though kids are fed well, parents are conscientious. It's not like they're giving them Fruit Loops and Mountain Dew, right? They still have nutrient deficiencies that are pretty significant in most cases. And they also have what we call mitochondrial dysfunction. If you want more information about this particular topic, go and watch one of my latest webinars about it. So if you go to thewhymatters.net, go to webinars, scroll down, you'll find it. But the mitochondria are organelles inside the cell that are responsible for making energy for the body. So the energy currency of the body is called ATP. Think of it like gas in a car. Most, I would say 97% of kids who we test have mitochondrial dysfunction. They are not good at turning their food into energy. When that happens, when you don't have gas in your car, you can't expect other things to work, like wipers and the defrost, okay? The body's the same way. So if you don't have ATP, if you don't have gas in your car, you can't expect good digestion. You can't expect sit down and pay attention at school, learn your math facts, right? You can't expect a good, robust immune system, etc. So in order to have higher level functioning, you've got to have good ATP production, and most of our kids do not. I usually see really low fatty acid levels, usually omega-3s. We also see really low cholesterol, and this is a big, big deal for complex kids. Again, if you want more information, go back to that website, watch the last webinar that I did on low cholesterol. So most kids who are complex don't do with fats what need to be done. And regardless of what our culture tells us, fats are not bad. Fats are good for us, especially for kids. They need them for, good cell function, good brain development, hormones. And it's exceedingly common for complex kids to have low cholesterol. Low cholesterol is not good. It will lead to behavioral issues, sometimes behavior that looks like it's psychiatric. It really also affects mitochondrial function. So low cholesterol is a very big deal. It's something I check on most all kids. We also see lots of intestinal dysbiosis. So kids who have high permeability, so their intestine leaks out its contents and triggers the immune system. We also see bacterial overgrowth, yeast overgrowth, very, very common. Low vitamin D, again, the high bacterial and viral load. So we just see so many kids who have PANS and PANDAS. And so we work really hard to target exactly what the infection is. And so we see, lots of strep, lots of Klebsiella, we see lots of mycoplasma, and high viral loads too. So things like Epstein-Barr, HHV6, etc. We see neurotransmitter dysregulation. So things like dopamine, serotonin, epinephrine, those chemical messengers that really affect a child's mood and their motivation, etc. Really common to see poor detox pathways. So these are kids who just do not do a great job of getting rid of toxins from their systems. We see lots of genetic, what we call SNPs, that stands for single nucleotide polymorphisms. So mutations is another way to say that. Most of us have heard about the gene mutation called MTHFR. It's probably one of the more well-known ones. There are hundreds of others, but it's very common. It's common for all of us to have these mutations, but our kids tend to be especially vulnerable to these particular genetics showing themselves or manifesting. We see lots of immune dysregulation. So kids who are sick all the time, kids who are never ever sick, kids who struggle to get a fever when they should. These are all important findings around the immune system. We also see lots of food allergies, food sensitivities as well. And then histamine dysregulation is a really big situation for our kids as well. So I'm going to give you a couple of examples of kids we've worked with. So Nora, at the time, was 5, typically developing, likely a gifted IQ. She had sort of an overnight acute onset of fears. So she had extreme separation anxiety from her mom. She lives in a tight family, right? They're very close emotionally, but also close proximity. And so she stopped looking at or speaking to grandparents and her uncle, who she sees all the time. She would have what mom called attacks where she couldn't calm down, was unable to sleep alone anymore because of her fears, low stamina, motion sickness, headaches. Headaches in a 5-year-old are not normal. They're common. They're not normal. And so when she came in, what I found, she had several retained reflexes. She had difficulty with some of her eye movements and coordination. She was very hesitant to try anything that wasn't verbal. So when I said, hey, do what I do, right? She wouldn't do anything like that. She would talk to me all day, but she wouldn't perform anything, gross or fine motor for me. Her pupils were hypo-responsive to light. That's a very common thing that we see. That is a sign that their nervous systems are not in balance. So they're sort of stuck in fight or flight. When you're running from a bear, you can't learn anything new. You can't heal your body, right? You can't pay attention to anything except running from the bear. So one of the things we were very keen about addressing is making sure kids can go from fight or flight to rest and digest carefully, easily. Her reflexes were inconsistent. She had a geographic tongue. She had red cheeks and low tone. And when I did some testing with her, we did a nutrition panel. So before I said I don't do the same thing on every kid, the exception is I do this particular test on almost every kid just because it gives us such good information. So again, this is a family. They're pretty crunchy, right? They eat real food. They cook every meal. They're conscious about non-toxic, like body care and home care things. But you can see here, this is telling us about Nora's deficiencies. So green is good, yellow and red means she needs support. And you can see in almost every single nutrient, she has a high need for support. She needs a lot of GI support as well. So this is already telling me, okay, there's some sort of metabolic reason behind this new onset of symptoms. When we look here, it may be hard for you to read, but what we're looking at here is a glimpse of her intestinal health. Very severe malabsorption. She also has a bacterial and a yeast overgrowth, both of which are pretty significant. When we look here, this is telling us about her mitochondrial function. So she struggles to make energy from fats. She struggles to make energy from carbs. And her overall energy making cycle is fairly dysregulated. We see that her neurotransmitters are not very happy either, and neither are her detox pathways. So we took all of that information and made an intervention plan for her. We put her on some supplements. We did chiropractic adjustments. We did craniosacral therapy. I wanted to do some blood work with her, but she couldn't tolerate the stick. So by the time we got all of this started in November, she was taking her supplements, doing everything she was supposed to do. Started, everything November, December. By Christmas, she was markedly better. Now all of her symptoms are gone. So she was, a fairly straightforward case. She definitely responded quickly. And now she's in school and she's doing fine. You would never have known that anything like that had happened when she was 5. And this is Corwin. He started seeing me when he was 5. He's quite a bit older now. When he first came to me, he had very severe mouth ulcers. And so you can kind of see, you can see his tongue, you can see the ulcers on his tongue. And he also had these ulcers on the insides of his cheeks. He had diarrhea, frequent urination. He would have fevers of 105 or higher for 7 to 10 days at a time. Very severe anxiety. He ended up missing the majority of kindergarten because of all of these symptoms. So this was an older version of the same test that I did with Nora. So it just looks a little bit different, but it's the same information. So he had some delayed eruption of adult teeth. This is really a common thing that we see. And generally, the culprit for that is mitochondrial dysfunction. Again, with the geographic tongue, the severe mouth ulcers. When I examined him the first time, his tympanic membranes or his eardrums were bulging, dark circles under his eyes, lots of the keratosis on his upper arms, as well as white spots on his skin as well, which is generally a sign of yeast overgrowth. So we can see here that he's got some, moderate to severe nutrient deficiencies in many areas. We did a stool test with him. And you can see, so these are good flora that should be there in high amounts. This is imbalanced and dysbiotic flora. So he had Klebsiella pneumoniae. He had strep and staph as well, overgrowing in his intestine. And then when we look here, this is a marker of what we call secretory IgA. This is so secretory IgA is a class of antibodies that are sort of the first responders to any immune challenge in the gut. And it should be less than 275. His is over 500. So his little tummy is on fire, trying to get rid of these particular pathogens. This is a food allergy and sensitivity test that I do as well. So we found a handful of allergies. We found lots of sensitivities as well. And so we did some blood work. We implemented a diet change. So we took away the things that he was allergic and sensitive to. We supported his intestinal health. We made sure mitochondrial function was where it should be. We did chiropractic adjustments. We did craniosacral therapy. We also intervened with some oral restriction issues that he had as well. And look how much better he looks, right? Now he's a big kid. He's, doing great. But this was a major challenge, and the family was about to go broke, going to all these different doctors and getting all these scopes and, all these tests just to be told, oh, we don't know what it is, right? Take some more medicine. And really what he needed was support from the inside out. All right. So are you concerned about your child? Anything that I have said, does it ring a bell? Does it make you think, oh, my kid has this and that? Here at Covenant, we have lots of ways to help you. So we have nutrition testing options. The test that I did for both Nora and Corwin is a urine test. So it's so much easier for kids to just do that, catch their urine. Even kids who are still in a pull-up at night, because it's a first morning urine, we have ways to collect urine, even in a child who wears a diaper or a pull-up. We have intestinal health testing options. So we have, a variety of different stool tests that we can do. If you're worried about parasites, we can test for parasites as well. We offer genetic panels that are saliva-based, which is nice. We do food allergy and sensitivity tests. Some are blood, some are hair and saliva. And while, no kid loves to get a blood draw, right? Even adults don't want to get their blood drawn. But we are exceedingly good at doing blood draws with kids here, especially kids who just very vehemently do not want to have it done. So we're generally 99% successful on getting blood draws for kids. And I remember Rowan never wanted to have his blood drawn either. And so, it's a little traumatizing for parents and for child. And so we're just very sensitive to that. We're patient and we're gentle and, we're just really great with kids. And I'm also just very aware of how difficult it can be. So I weigh, the value of those results versus, the difficulty getting that blood. And, if I feel like it's not necessarily something we have to have information on, we won't do that. So I really do base that decision on that particular child. So the part of what makes us different, though, is that so I have many, many families who will come to me and they'll have a stack of test results. And I'll say, oh, so you've already got tests? That's great. What did your other practitioner tell you to do? And they'll say, well, they ordered the tests and we got results, but they don't really know how to read the results and they don't really know what to do with it. And that is so frustrating to me because people only have limited resources, right? Resources means patience, emotional bandwidth, time, money, right? And so when families come to me with, all these results and nobody helped them know what to do with them, it's super frustrating to me. So we are very, very good at analyzing results. We know what tests to order. We know what to do with the results. We don't order tests just willy-nilly because you have limited resources, right? And so I want to do the test that's going to give us the most information that we can do something with. We offer a very comprehensive plan based on those results. So after we've done testing with a child, I sit down with the parents with a written report that says, line by line, this result means this. Here's what we're going to do about it. I will never say, wait and see. When we're dealing with complex kids, 6 months or even 3 months is an eternity at that age. The amount of progress we would be able to make in 3 months or 6 months when we get right to it is amazing. So I never want to just say, we're going to wait and see unless I really and truly feel like it's the right thing to do. I will never say, this is just an autism thing, or this is just a PANDAS thing, because none of it is, right? Like there are symptoms that go with autism. There are symptoms that go with ADD or PANDAS, but there's a reason behind it. There's a metabolic reason behind it. And it is not a deficiency in Adderall. It is not a deficiency in Tylenol. There is a reason, and we need to do our very best to figure out what that reason is and correct it. Our plans usually consist of supplements, sometimes homeopathy, sometimes diet change. Chiropractic adjustments are a very common thing that I recommend, as is craniosacral therapy as well. And the changes that we see are pretty dang amazing, right? So we see behavior, language, socialization improvements. We see better sleep. We see kids who start eating more than 3 or 5 foods. We see better poops. We see better cognition. We see increased connectedness to other people and socially. I don't know that I've ever had a patient who we made no progress on. Now, I can't guarantee that we're going to recover your kid, but what I can tell you is we're going to see changes. And generally, those changes are very noticeable. So I just met with a family yesterday, and the mom said, he's in there. We're finally seeing that he's in there. And this is a child with autism. And over the holidays, she said the rest of the family noticed it too. They're like, oh my gosh, what are you doing for him? he's so much better. He's in there, right? Um, I also worked with a teenager. She's a senior in high school, and her neurotypical, like gifted IQ, super high achieving girl. Her main concern was acne on her face. And she messaged me last night and she was like, "Oh my gosh, she's like, I know you usually work with much more significant cases than mine." She said, "But after only like 6 weeks, her acne is completely gone." And she was just so thankful because it really affected her self esteem and her confidence. And so, even something like that, we got it figured out. We looked at hormones, we looked at nutrition, we looked at gut health, we fixed all that. And just weeks later, her skin is completely clear. So there's a reason behind everything. And that's why I always say that the why matters, right? We have to look for the why behind whatever the symptom is. It is never just autism. It is never just ADD. There's always a reason. And if we can sort that out, address it, fix it, then when a child feels better, they behave better, right? They can pay attention to their peers. They can pay attention to language and they can connect with their families. And that's really my life's work and my mission is to just help as many kids as we possibly can. So if you have questions, if you're concerned about your child, if you think that what we do here would be a good match for your family, definitely reach out. So we just brought another doctor on. So we have 4 chiropractors on staff now. And our new doctor is particularly interested in this kind of work. So I'm teaching her to be me 2.0. So we're really sort of cultivating a team of us who know how to do this work. And so that will increase our availability. My schedule is pretty full. And I hate for patients to wait. It stresses me out because I know, that families need help. So anyway, all that to say, we are always taking new patients. And so if you feel like you need more information, if you want to schedule an appointment, you can always call us, you can email us. If you have specific questions about how to schedule, what the prices might be, you can email Brittany at covenantwellness.net, and she will be happy to answer all of your questions, get you scheduled, etc. So, all right. If you have any questions, you can drop them in the Q&A box. I'll give us just a minute or so to ask any questions. Other than that, I'm going to let you guys get on with your day, and I'm going to fight the snow to get home because we had quite a snowstorm last night. So last call for any questions or comments. I'm so happy that you guys joined me today. Because you registered, you will have forever access to the replay of this. So if you want to, go back and review anything that I said, watch it again as many times as you want to. You're more than welcome. Oh, Katie, hi. I'm so glad that you joined us today. You're like one of my favorites. So, all right, guys, you have a fantastic day and a great weekend. And again, if you have any questions at all, you can always call or email us. So have a great day. Thanks so much.